Good afternoon, everyone. My name is Wendell Greenidge, and I'm a registered nurse in critical care unit at Sunnybrook Health Sciences Center in Toronto. I left Barbados about 33 years ago, and currently I'm also a nursing professor at Seneca College, and I also teach second year nursing students, second year nursing students.
So what was your routine like in Canada prior to COVID-19?
Um, My routine was I'll get up on mornings, and if I'm not going to work, I'll probably relax a bit, go out and do normal things that normal people would do. Going to the mall, hanging out with friends, going partying, going to dinner. And I also coach, and I coach at the provincial and the domestic level. So I was very involved in that. And this is prior to COVID. And once COVID occurred, then our daily lives were pretty much put on pause or standstill.
And the lockdown went into effect, and we saw videos on social media with some very long lines and empty shelves. Tell us about the impact that that would have had on supermarkets, on food, on getting basic supplies in Canada.
Well, I don't think that it had much of an impact on us getting basic food. What changed was the way that it was done. So when social distancing came into effect, or prior to social distancing, we could go to any grocery store, enter it at will, and purchase the necessary products, goods that we needed. When the when the city went into lockdown and the social distancing rules were enforced, this impacted the way that we did our grocery shopping, meaning that we would stay in lines for maybe as long as half an hour, 45 minutes. We kept that 6 feet apart and distant. And it was the fear that caused us to respond to shopping the way we did. People thought, okay, well, if the city was in lockdown and there was a need for food because we weren't too sure if the grocery stores were going to be closed as well. So most people bought in bulk, which was expected, as I said, because of the fear of the unknown, and that's the reason why that happened. Once it became routine, then that attitude changed, and people knew, okay, well, groceries will be available, but it would take us some time to get the items that we needed. And we adapted to that norm. And currently, we're still in that position, and we can go to the grocery store, get whatever products, goods that we need, and that doesn't impact. It hasn't really impacted us significantly after that.
And I asked your colleague Brenda the other night, how is it now traversing to and from work? And she was making the mention that the streets are clear now. So how is it? How is life in Canada now it is on lockdown for you?
Well, like I said to you early on, we can't do the social things that we would have done prior to COVID. We stay at home, watch television. You can't go to the gym. You can't hang with your friends. You can't go to the park. Yes, the streets are pretty clear. Unlike Brenda, I live 3 minutes from work. So whether the city was back to normal or not, that would have never impacted me. But coming from this has taught us a new way of life. I don't know if we would ever go back to where we were before, right? But I'm hoping that that would be the case because I miss my friends. I miss hanging with them. You can talk to people on the telephone. Communication is very important, but the social connection is what keeps us together, right? And that's the part that's missing.
And moving over into your work life now, in terms of being a nurse, what are some of the cases that you've seen in terms of the gravity, in terms of severity, worst case, best cases that you've seen?
Well, I work in ICU, so we are going to get the very acute of the COVID patients. And I worked this past weekend, and I took care of a COVID patient that was really sick. The thing is, what we're hearing in the media, and what we're actually seeing on the front line, two different things. So it is still a lot of fear because we're not too sure how the virus is spread. Yes, public health is seen to us that is airborne, but then there's some communities that are coming to hospital that they haven't been in contact with the public. They haven't been exposed to people that had SARS, and this is the enigma. Um, Providing care for those patients, you have all the required PPE or gown or gloves or mask and a face shields, a cap. So that has never been an issue, but you're still providing care to those patients, but there's still an element of fear, right? And you can go into a patient's room and the ventilators become disconnected. So that's an acute crisis. So if you're not properly prepared from outside and the ventilator is disconnected, then you got a guard and everything. By the time you get into the room, then the patient could be in a worse situation, could be in cardiac arrest, and then you have to perform CPR and stuff like that. So this is where the challenges, come in. As a healthcare team, including nurses and RTs and the PSPs, we work collectively really well. At the end of the day, we want to provide quality and safe care to the patient with the intent of getting them well and get them back to normal and getting them out of the hospital back to their previous family life.
Why is the virus more of a threat to the elderly and those with underlying conditions such as asthma more so than any person else?
Well, initially the research was saying that because that was the population that we were seeing. But as we got deeper into the virus, it's across the lifespan. So we're seeing younger people, we're seeing teenagers, we're seeing people in the 20s, we're seeing people in the 30s, and this is a mystery. We don't know why this is happening. Yet initially they were attributing it to people that had respiratory challenges and the elderly. And we did a case review last week, and one of the intensivists alluded to the fact that you get a cytokine storm when a person becomes infected with the virus, and it attacks the lungs. So if you're asthmatic or if you're COPD, then you have challenges with breathing and what have you not. When the storm attacks the lungs, then you get a huge inflammatory response. You get a lot of mucus being produced, and this plugs the airway. So this causes the patient further respiratory complication. Now, if you're elderly, right, and you have any underlying conditions, right, it all goes in a cycle, and this impacts a person. But moving forward, we are seeing younger people, right, like they said, and this weekend, I heard of another institution where there was a young lady, 30 years old, with no signs of symptoms, and she was intubated for COVID. And that's the challenge. We haven't done enough research or enough clinical trials to look at exactly why it impacted the elderly in the beginning. But I'm sure over the course of the time, and maybe as we get deeper into the disease and we do a lot more randomized controlled trials, then we can answer that question, why it happened to that community versus the younger community in the beginning. But hone it in on the fact so people can get the message. I know and I saw Brenda's interview. Brenda linked the fact about nursing, about SARS and COVID, which I think was really good.
Mm-hmm.
But I think the message here is that we need to listen to public health, follow the guidelines, right? Wash your hands, social distancing, avoid crowds, and stay at home. I forgot to include that one, stay at home.